access to essential and life-saving medications is at risk. This is because influential groups want to ration access to healthcare, and they're using discriminatory tools to do it. One of these groups is the Institute for Clinical and Economic Review, or ICER. ICER produces reports that claim to look at the cost-effectiveness and value of a medication. These reports are then used by private health insurance companies, as well as the Veterans Administration and some state Medicaid programs, in their decisions about whether to cover a medication and how much they're willing to pay for it. ICER calculates value by using a metric called the Quality Adjusted Life Year, or the QALY. The QALY places a dollar value on each year of a patient's life. QALYs are discriminatory because they tend to value younger patients over older or sicker patients, simply because of how many years each group has left to live. So ICER's math suggests that medications for older patients or people with disabilities are less valuable and may not be worth paying for. Thankfully, there is bipartisan opposition to the use of the QALY in federal health programs. Now, ICER has turned to a new metric, the evLYG, or Equal Value of Life Years Gained, claiming it fixes the biases of the QALY. But just like the QALY, the evLYG places more value on treatments for younger and healthier patients, and leaves older and more disabled patients with fewer options and higher bills. An article published by an international health economics organization reports that both QALYs and evLYGs consider treatments that cure disease or extend life as more cost-effective than treatments that primarily improve quality of life. The National Council on Disability, an independent federal agency, found that the evLYG measure does not fix the inherent biases of the QALY or help improve patient access to new therapies. The evLYG is just tokenism, not real reform. ICER is offering up the evLYG as a new tool for Medicare to use in price negotiations and other coverage determinations. Don't be fooled. This is simply trading one discriminatory metric for another, and it won't help patients. It's time for Congress to ban the use of QALYs, evLYGs, and any other metrics that claim to determine value while valuing some patients over others. These metrics have no business in Medicare, Medicaid, or any other federally funded payment programs. Visit ICERFacts.org to learn more and find out how you can help.